Hello, Dr. Gomez here from the University of Texas Health at San Antonio, and today we're going to have a case presentation of soft tissue cavernous hemangioma. AP and lateral radiographs of the leg show no osseous abnormalities. There is no fracture or periosteal reaction. This patient presented with a palpable mass. However, there were no large soft tissue lesions seen on this radiograph. We saw some small rounded calcifications within the posterolateral soft tissues of the mid-leg. As you can see in this zoom view, there are two well-defined rounded calcifications that have lucent centers. These are characteristic for phleboliths, which are commonly seen on vascular malformations. Ultrasound was ordered in this patient for the palpable soft tissue mass, and we see an oval-shaped echogenic mass within the posterior soft tissues of the leg. There are some regions of calcification with sound absorption and acoustic shadow. These are consistent with phleboliths. Upon Doppler interrogation, we see slow arterial flow within the lesion, and there is no significant acoustic enhancement throughout the lesion. Eventually, we did an MRI on this patient to further evaluate the mass at the posterior leg, and what we can see on the T1 weighted images is that there is an intramuscular lesion which shows mostly high T1 signal intensity, both at the axial and sagittal sequences. Also on the T2 weighted images with fat suppression, we see that the lesion again is well defined and has mostly increased T2 signal intensity. On the coronal images, we can see that increased T2 signal intensity is actually tubular structures, which is most consistent with dilated vascular channels. We can also see a feeding vessel. This is really important for hemangioma, that it shows slightly increased T1 signal intensity because of the intralesional fat, and also that on T2 we see these dilated vascular channels, but they are still high on T2 and do not show a flow void because the flow within the vessels is really slow. Also, if you can notice, between these tubular structures there is decreased T2 signal intensity with fat suppression. That is the intralesional fat that is having some fat suppression. So we confirm that there is fat. Also, we can evaluate that on a T1 fat suppression image if you have one. Here we have axial and coronal T1 fat SAT postcanalicular images, and we can clearly see that this lesion diffusely enhances. Also, we can kind of delineate the enhancing tubular structures of the dilated vessels, and we can see some internal regions of decreased T1 fat SAT signal intensity, which is related to the suppression of the intralesional fat on this fat suppressed images. On the coronal images, we can clearly see the feeding vessel. So let's talk a little bit about soft tissue hemangiomas and soft tissue cavernous hemangiomas. Soft tissue hemangiomas are benign vascular lesions seen in the soft tissues. There are 5 subdivisions: the capillary, cavernous, arteriovenous, venous, and mixed variations. Capillary is the most common and usually seen on babies. This usually resolves spontaneously. The second most common is the cavernous, and they are usually seen in the deep soft tissues, usually within muscles. These don't resolve spontaneously. Soft tissue hemangiomas can be symptomatic with chronic pain and is usually related to the size of the lesion. Some of the complications clinically can be steal phenomenon when the lesion is stealing the blood supply from other important organs. In cavernous hemangioma specifically, when a patient exercises because they are within the muscle. The treatment is surgical, especially if they're symptomatic. Cavernous hemangiomas again are within the deep soft tissues and usually have calcification in 50% of the cases, which are seen as phleboliths. On the radiographs, we see the phleboliths. Unless it's really large, we don't see anything else. You can see osseous changes if the hemangioma is close to the bone, like periosteal reaction or cortical thickening. In ultrasound, we can see the phleboliths and also low resistant arterial flow. And the things to look for in MRI is intralesional fat, enhancement of tubular structures, and a feeding vessel. Thank you.